over here because the clicker isn't going to work for me up there. And I just want to point out before I give an introduction to myself that the last question about human connection is a great bridge, because that's really what I'm going to be talking about. Patients today are finding their own information and they are making their own decisions about their care. And I want to talk about how, as healthcare organizations, we can kind of step in and continue to play that role along with patients. So as you heard, I'm Liz Presson. I work with a number of technology and healthcare companies to use digital media and content online to connect with patients and to help patients connect with each other. So as you can see here, a lot of what I do, all of the work that we do really is based around one question. And that question is, tell your story. Can you tell us your story? And so it's fitting that I'll start with a story of my own, a quick story of my own. So this summer, a friend dealt with mental illness in a way that I had never experienced before and that he had never experienced before. All I knew to do was to be there, to listen, to show my dedicated support and care. What I didn't realize is that I would actually be the person who would have to commit him to the hospital for fear of his own life. And that hospital visit lasted much longer than either one of us expected. I went there daily, I called daily, I ate up all the information available to try to figure out what was going on and to understand what the best next steps would be. But I felt blank. We walked out of the hospital on his release day, and I had a million questions. Questions like, what medications does he need? What happens next? Will he ever get better? How have other people coped with this? What am I supposed to do as a caretaker and a supporter? And what does this diagnosis really mean? And I also couldn't help but think, if there's so much information out there, why do I still feel so incredibly lost? Really, when I thought about this, one question encompassed it all. Who can I trust for answers and support? And in my work, I've heard all the questions that I mentioned before, and I've even done work to try to help answer them. But when it came time for me to go through this by myself, I came to the realization that we might not be answering that as well as we could. And I came to the realization that this is the role that we need to help organizations, our clients, play. The connective tissue between trusted, valuable content and connection. So how can we take the research that organizations are doing and have, the data that organizations have, and pair that with real patient experience? Simply put, here, in its most simple form, to turn information into insight. Information to me is the raw data. It's the binary information, the zeros and ones. And insight, on the other hand, on the other side of the equation here, implies meaning. It's what we do with the knowledge. So it's the next step after the knowledge. It's got all the non-essentials removed, and it's paired with that real experience that I mentioned. And it also comes with an obvious next step because it crystallizes what's important. So today, I just want to share a very tactical, simple, four-step approach. I know this is a deeply emotional and human condition, but I want to share what some organizations are doing to try to help answer that key question. So that day when I walked out of the hospital and I felt helpless and my friend felt helpless, the first question that we had is, who can we talk to who's been through this before? We heard from Julie Cerrone yesterday, who left the doctor hearing that by the time she was 60, she wouldn't be able to walk because she could only get 2 knee replacements in her lifetime. So she went online and she found another solution. People are going online and finding social support. They're asking other people what they've done when they're not getting what they need from the clinic or the hospital. So social support becomes so important. In Julie Flieger's talk last year, she said that the failure to recognize and explain social support is a medical error. And my ask to organizations and what we try to do is to not just prescribe social support, but to listen, so to find it and listen and see how people are supporting each other, curate suggestions for social support, and to get involved, to influence that social support with the expertise that we have as organizations. You know, you've been here, you've seen this, you've heard from Simpler a few times around now. This is a great way to find social support that's happening today. So we suggest tools like this to our clients to find the conversations that are going on, listen, insert yourself, and meet people who you can get more deeply involved with what you do as an organization. You know, we want to give people and patients ways to get involved. Content, community, patient tool development, from experience, we've had failures as well. If you don't co-design with the people who are living in it and design with them, you will fail. We need to understand what people really want and need, and patients know what they want and have evidence for it. So what the opportunity here is to create highly curated communities. They can be formalized as mastermind or advocacy groups, or they can be more simple as just online groups. And so I just wanted to show a really, really simple example here. This is a closed secret Facebook group, but these are public advocates, so able to use their photos here. It's a simple online group that we created for one of our clients called Oticon Medical, who sells a hearing device. And patients speak to each other here. We try not to influence much of the conversation. But when the company needed to prioritize a number of new products for marketing, FDA approval, this is where we went. And we simply asked this closed community what they thought. And we went with their suggestion. We left with quantitative and qualitative data in hand about what product they thought that the world needed based on their experience. And when that product came out, it was amazing because they did the marketing for us, they made the sales for us, and they felt heard, which is most important. Provide a safe place for people to learn and connect. So this is huge because I've always said this, but I recently learned it in my experience. In profound moments, in truly vulnerable times, people want information that they can easily understand, but even more importantly, they want information they can trust. So we've become savvy. We know that Google is our friend, but in a moment of need, we don't necessarily want to read a WebMD page or look through Yahoo Answers. I know I didn't. And so we're advocates of creating a platform that brings together educational content, so the research that you focus on as an organization, real patient experiences, and information on potential next steps. Those three things together are what creates the insight that I mentioned earlier. This isn't your website. It's a niche platform that is for patients to help them understand and absorb what you know about their condition and to connect with the experiences of others. So I don't know if everyone in here heard from Jerry Burchell this morning. I hope so, because it was a really amazing talk. But she was talking about clinical trials and trying to find information online about what it would be like to participate in a clinical trial. And what I think is great is that if you're watching the video closely, this website actually was in the end of it, which is great. The team at Lilly actually heard her. They heard people like Jerry. And they created the type of platform that I'm talking about that aims to educate patients on what it's like to go through a clinical trial, to understand what has happened to other people in their experience, and then to connect them with next steps of trials actually in their area. And so it's a great example of developing a platform that helps people learn and figure out what's next. One more quick thing on this. I think it's so awesome. By co-designing with patients, the clinical innovation team at Lilly is continuing to iterate and to add information about different disease states so people can not just learn about clinical trials, but more about the treatment options for their specific condition. 4, make research and insights accessible, easily available, human. I am a firm believer that we need to ask, how do we reach people outside of this immediate patient community? So we've got people here who are so engaged, they're so tapped in, they're in this immediate community, but how do we reach people outside of that community? And I mentioned building a platform. I showed Lilly Trial Guide, but if you build a platform and create content, that doesn't necessarily mean they will come. So even for a disease that affects so many people, mental illness, which is what I was looking for information on, The right information felt buried, it felt untrustworthy, and like I said earlier, not human. So there's a huge opportunity for organizations to play a bigger role in awareness and to really surface their knowledge and resources in a more human way, just like we see e-patients doing today. Really interesting example here. One of the most interesting ways that the Lilly Clinical Innovation team that I just mentioned is working to heighten awareness around their platform and around their cause is by sharing this foundational information on a well-known public platform. So this is a BuzzFeed article that actually takes some content from the platform that I just shared, and it's now being served on BuzzFeed so people can find it. We're raising awareness of the cause, and if people are interested, linking back over to that educational platform. So really simple ways, but not a ton of organizations are doing this today. And I'm just going to flip back to my questions here, because this is what I kept revisiting, all these different questions. And I really believe that this is what MedX is all about. It's about fostering partnership, mutual respect, and teamwork in order to provide answers that people, all of us, will someday need. And so, next time you think of what patients are looking for or how we can show our support as organizations, I would ask that you ask the question to yourself, how can I be the place for trust and support? And think of some of the tactics that we talked about today. Thank you.
Any questions? I have a question.
Sure.
So with all this information going online, how do you trust the source, or how can patients trust? If it's just Lilly, like you said, is obviously a trustful source, but yes, everything else on the internet, what do you suggest to patients or people looking for information? Yeah,
that's a great question. So, like you said, Lilly's obviously a trusted resource, but I think that that's where I'm going to keep on with the Lilly example since we were talking about it and it's so relevant. I think a great thing for patients to look for and organizations to do is to look for the humans within the organization. So if you were to look at blog posts from the Lilly team, you could see that team members are actually talking about this as a trusted resource. And so I think on both ends, let's find the humans in the organizations and see where they point us. Ooh, good question. Yeah. Well, I put the onus on, I put the onus on the companies themselves, because I think that there are companies today that are listening to people, and I really believe that the ones that are going, won't be in business for as long. I mean, the world is changing. People want to be heard. And so I think that I put the onus on the business to do that listening. And when people aren't heard, they're going to have more and more places to go where they can be heard. And so that's kind of my philosophy around it.
Is there any other questions?
Great, thank you.